Hi, I'm Kimberly Isaacs. I have a research project that I research subject that I am very passionate about. I currently work at Bethesda North Hospital as a case manager. I've been there almost 6 years. I've worked on the same floor for all this time. It's the oncology and surgery floor. And frequently the oncology doctors and residents, nurse practitioners all get together in the afternoon and discuss the patients that they have and their treatments, tests that they might need, and just different things. A few months ago, I heard one of the doctors say that it would be really neat if there was a way to document in some kind of database across all medical fields to input information on patients and their symptoms, their diagnosis, what tests they've run, and treatments that worked, didn't work, and things that happened when they did do the treatments. I found that very interesting. In my mind, I've always thought that was an important thing to have for the future. I'm a very big MyChart user. I communicate with all my doctors frequently using MyChart. That has increased in value immensely over the last 5 years. I think there's a lot of big, greater changes that could happen with it. But my research project, the databases could be used by all the major health networks across the United States, possibly even the world. The doctors could input information for patients in a big database, and that way if a doctor in a small town has a patient that they just don't know what is going on, they could input that information and then maybe get some added information that they don't have to help in their treatment of that patient. I know right now in one of the articles that I found, UCLA Health, they have an AI-powered tool that they already use for their own organization, and it helps the doctors detect rare diseases in their organization. They input the patient's data, and then it helps them diagnose and treat those patients. I know there are a lot of challenges in making this work. There's the HIPAA laws, the patient protection, there's ethical issues that surround it. I think with a little bit of work with a few people, it could actually work. And I think it also could be integrated into all of the information on tests that we have ran that are part of our medical charts. I think this would help doctors, and I think it's important to our future health and finding treatments for patients and getting people more healthy. I'm extremely interested in this article. I'm sorry this is kind of last minute. I'm actually on vacation in Panama City Beach, Florida, so this course was something I signed up for at the last minute too. So, but I am interested in this, and this is probably going to be my research project for this class. Thank you for listening. Hope to talk to you soon.